Good afternoon, class. My name is Tony Howdragi, and I am stepping in for Dr. Parrington for the remainder of the semester. I apologize for any confusion or um, stress this whole transition may have caused you. I know some of you have had some questions, and I'll try to make things as simple as possible because I know transitioning with professors towards the end of the semester can be difficult. I know Dr. Purrington probably had her way of doing things, and I have my way of doing things. And so I hope to make this transition as simple and as easy as possible. There is no need for a Blackboard discussion this week. Everyone's going to get full participation points. I'm just going to kind of lightly go over the material that would have been for this evening. You guys do have a paper due, I believe, this coming Sunday. I did have a question in regards to the paper, and I think it's just looking at it, the vignette from the perspective of, for the counselor, what do they need to do with the information given as far as their client potentially wants to harm someone and they have a way of harming them. I don't know if that's helpful or more confusing for you. So if you have any questions, I posted on Blackboard my email address and my phone number. Excuse me, I can be reached at both places, and I try to respond as quickly as possible. So we will be meeting in person next week and the following week, and then I figured the week of week 16, I figured we don't need to meet just because it's the last week and you guys are trying to wrap up finals and things of that nature. But again, I want to be able to be as helpful as possible for you and hopefully continue where Dr. Parrington has left off with what she's been teaching you. It will be good to see you all in person and answer any questions or talk about legal and ethical issues because obviously this is a huge part of what you're going to do as a clinician. I myself, I'm actually in my office right now, but I myself am a licensed marriage and family therapist. I have a practice, my own private practice, and then I supervise um, individuals who are going to be um, counselors. So I do have some experience, if that helps you at all to know that I do. Anyways, so this week you're on chapter, I believe it's chapter 10. And it's issues in theory and practice. And it just seems to really be talking about why it's important to understand what you're doing with your clients, to understand your style. Everyone's different on what they want to do for style. For me, I would say, and probably a lot of clinicians come from a cognitive behavioral perspective. And that's not to be cliche, it's just that's a very broad, cognitive behavioral therapy is a very broad way to treat a vast, spread spectrum of problems or disorders. So that's what a lot of people say. Really, when you talk to most clinicians, they may not even necessarily even tell you a theoretical orientation. But from a counseling perspective and a way of trying to sell yourself, it isn't a bad thing to know what your theoretical orientation is, so to make sure you're operating within scope of your practice and doing things that are accurate and correct within that scope. Um, so again, you must be doing things that you are able to do. So for example, I am a licensed marriage and family therapist. I am not going to prescribe medication because I can't, nor will I give recommendations on what to do for medication. Now, I can suggest someone to see a psychiatrist or see a doctor, but I can't tell them what's wrong with them because that's outside of my scope as far as like a health issue or something wrong with their medication. I will always direct them back to a physician, because that is outside of my scope of practice, right? Um, which that might sound basic, but sometimes things can, even recommendations for herbal supplements or vitamins or oils or any of those things, we could get in big trouble, especially if someone has a problem with them and it came as a recommendation from us, right? So it's important that you know what's within your scope and what's not within your scope, and that you know what your style includes and it doesn't include, right? And even certain things require that you have certain certifications. So to say that you do something, you might not be doing it within the context that you're supposed to, especially if you need to be certified. Like, for example, I do EMDR therapy with clients. Um, if you're not trained in EMDR, you shouldn't be doing EMDR with people. So just even things like that are important to take into consideration. Theories of counseling are based on worldviews, each within its own values, and it's particular to the clinician. You determine how you want to present yourself and what you want to do in your own counseling environment, assuming you have control over it. Some of you may choose to work at a facility where the theoretical orientation is decided for you. Others of you may work in a more general setting where you get to determine the kind of practice you want to have. And that's based on what's comfortable for you, what you like, what you don't like. I think it is based a lot upon personality. That's how we develop our counseling style, what goes with our personality, what works with us. You have to be yourself within the counseling room. If you're not, then you're going to have a hard time. So again, this is a way of figuring out something that works within your personality, your own probably morals and values and ethics that you agree upon, and then goes with the way you want to structure your counseling environment. So one way to clarify the shared responsibility in a therapeutic relationship is by a contract. So between the client and the therapist, I have what we call a client service agreement. And within that agreement, it talks about what the client's rights are, my rights are. It talks about who I need to get a hold of if there's an emergency. It talks about payment. It talks about what happens if they don't come, things of that nature. And that's a good way to establish boundaries, right? And limitations within therapy, and who can, when we break confidentiality, when do we not. Again, a contract encourages clients and therapists to specify goals potentially. What's the purpose? And then sometimes within insurance companies, you deal with, they are going to know obviously diagnoses and things of that nature. So it's good to be on the same page with that with your clients. I myself deal with insurance, and it can be a bit tricky at times, not from a legal and ethical perspective, more or less just the hassle perspective. And just so you know, I mean, I know you're only going to be with me a few more weeks, and I'm just covering the tail end of your course. But if you guys ever have any questions about private practice or your internships or traineeships or anything of that nature, please don't hesitate to ask. I love to help people on this journey to private practice or to whatever you decide to do within our field. Sometimes we just have some questions and we just need someone to answer them. So if you ever have any questions, please don't hesitate to ask in regards to those things, because I'd be more than happy to help you. Deciding on the goals of counseling, both therapist and client should clearly understand the goals and work together. Now, granted, we can establish those goals, but it's up to our clients to partially meet them too, right? We can do as much as we can do, but it's up to the person to kind of follow through. Actually, at my office, there's this cute little embroidered sign, and it says, God feeds the birds. God feeds all the birds, but he doesn't bring the food to their nests. And that's the same with therapy. Sometimes, someone just needs someone to kind of get them started, and then they'll take off and fly on their own. Other people, they need a lot more hand holding and spoon feeding. And then at some point we have to determine what's too much and what's even creating a problem, if we're like the only person that person has and they're fully dependent on us, and are we really then actually achieving the goals that we were looking for. So stuff just to kind of keep in mind. So we might have short-term goals, long-term goals, things that are within, days for people. Like this week, I really want you to accomplish this, blah, 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 blah. It's agreed upon to maybe longevity type goals. And this much time, this is what I'm hoping for myself, things of that nature. We have to be intentional as clinicians. We need to be mindful of where people are at. And we have a lot on the line. You work very hard for your license. For myself, it went from, I think I started, it was about 5 years, from 2005 till 2010 until I was licensed, and that's trainee, intern, and then being a licensed individual. That's a long time. That's a lot of energy, time, commitment to get my license. So it's up to me to fully protect my license, and that comes from me being intentional, knowing what I'm allowed to do, not allowed to do, and when situations arise, seeking counsel. I know myself, I'm part of CAMPT, and what CAMPT is an association for California marriage and family therapists. I fully suggest getting involved in something like that when you start to see clients, because they offer legal counsel. And not that I've used legal counsel in the sense that I've needed an attorney, but in the sense I've loved to be able to ask attorneys questions. You know, I had this class, Law and Ethics, when I was in your shoes many years ago, and I don't remember every law and every ethical situation and how to approach it, but it's nice to be able to call someone and ask them, and they can tell me what's in my rights and my abilities in order to act a certain way. So I really do suggest that because it is helpful to have that on hand if needed. Techniques in counseling. The techniques counselors employ, although important, are less crucial to therapy outcomes than are interpersonal factors operating in the client-counselor relationship. So, diagnosis as a professional issue. Key terms: medical diagnosis, psychodiagnosis, differential diagnosis, and DSM-5. So these are all things that we may look at, right? And we always want to rule out medical. So when you have someone coming in your office, like for example, eating disorders, going back to like what was said earlier with techniques in counseling, some of us may have a population that we work with that there's a higher risk, right? Because with an eating disorder, you have medical issues going on, that's mental psychological issues going on, and it's one of those mental health problems that has a high risk of potential loss of life. So we have to take documentation and things like that. We should always take it seriously, but we really need to make sure we're on top of our game. So you always want to refer out to a doctor. If there's any changes, anybody's feeling a certain way, even with depression, anxiety, you always want to rule out things. I've had a client come in here. She was diabetic, hadn't seen a doctor in years, and was suffering from some dementia, and they think it could have been diabetes induced. But if I hadn't been seeing her and I just didn't address how forgetful she was and how repetitive she was, she would have, nobody would have known what was going on in her life, and it was clear there was something so off for her. So it's important that we rule out medical. Once we rule out medical things, then we can look at what's going on psychologically and then address it from there, right? It's important to kind of have a clear picture of what's going on. So again, there's a lot of different types of therapies and ways to assess. You want to go with what's comfortable for you. Like I said, a lot of people tend to be cognitive behavioral therapists. We're really into mindfulness right now. That's very popular. You know, but it depends with the clinician. I've dealt with some clinicians that are purely psychoanalytic. But again, it's all up to you. You want to know your DSM, or at least understand how to get to it, and how to be able to look at it and use it. Things are kind of different now compared to the DSM-4. However, that might be irrelevant to you guys because you probably never used the 4, you've only used the 5. So we don't necessarily work on an access basis, but you want to understand the material in there, and again, know how to look up and understand better diagnoses. I always tell my clients, I have one sitting on my end table right here in my office, and I get it out quite frequently. And I always say, this is like the Bible of psychology. This is the way we look things up and better understand things. So it's important for you to know and understand it. So we look at developmental issues, gaps in current system, disability and impairment, neuroscience, and cross-cultural issues. All those things are kind of looked at in the DSM. So arguments for psychodiagnosis: no third-party reimbursement without acceptable diagnosis, difficulty to formulate treatment plan without defining the problem, provides team members with a common frame of reference, and allows therapists to rule out medical conditions. So again, in private practice, unless I'm using insurance, that's when I'm billing a diagnosis, right? Because I have to. And within all insurance, you have to give someone a diagnosis, whether it's adjustment disorder, anxiety, depression, schizophrenia, whatever it may be, they have to have a diagnosis. Now, if we're not using insurance and they're just a cash paying client, I might not sit there and diagnose the client with, you know, we might be working through something very general like anxiety or whatever. Now, some of them already have pre-existing conditions that they bring into therapy that we know about, like bipolarity or whatever. But it looks very different with my cash paying to my non-cash paying clients. Some people feel very strongly about not diagnosing after only meeting someone for so long, but if you're going to use any form of insurance, you have to diagnose. There's just no ifs, ands, or buts about it. So, ethical and legal issues in diagnoses. Some practitioners who are opposed to a diagnostic framework take the path of least resistance, giving every client the same diagnosis. Presenting an acceptable but inaccurate diagnosis is both unethical and fraudulent. So again, why would that be unethical and fraudulent? Because it's not actually true of the person, right? And so we don't want to just, because we don't agree in diagnosing, we don't want to just not diagnose or give everyone a very general diagnosis, but you want to be mindful of what you're doing and how you're labeling people too, right? So there's different arguments for and against. I had one clinician who didn't believe in note taking and said it goes against confidentiality, and she didn't note take at all, which, you know, when a state or government agency comes after you for notes for some reason, that's a problem, you know. So we might have these thoughts or theories, but at the same time, we have to do what's legally and ethically obligated of us. So make sure you're keeping that in consideration. Also, too, the only one who's out to protect my license is me. My clients don't care about my license. Insurance companies don't care about my license. I mean, of course, everyone cares that it's like up to date and such, but the only one that's going to be protecting me is me. And so making sure that you're making good choices, being on top of things, being mindful of decisions that you need to make, making sure that you're on top of it is important, because the only one that's looking out for you in a sense is you. So just be mindful of that as you're starting to practice and see people. Just, you want to be mindful of, I need to make sure I report to who I need to report to. I need to tell who I need to tell. I need to document how I need to document to make sure you're covering all your bases for yourself. And so again, we may use certain tests or diagnostic things in counseling. It's just, again, being mindful of how we document, knowing where our limits are as far as what we're allowed to give out as a test and what we're allowed to grade. Some tests require that you have some sort of educational backing in order to grade their material or have their material. So if it's not within your ability to do so, don't do things that you're not able to do, because that could come back and bite you big time. So again, we just want to operate in a legal and ethical manner. Findings from psychotherapeutic research. You know, most therapists learn more about effective therapy techniques from their experience than from the research. Approximately 10% of clients get worse as a result of therapy. The relationship between therapist and client is the best predictor of treatment outcome, which I do think some of that is true. Alliance is huge, and having a good therapeutic alliance makes a huge difference between a client and a therapist versus a therapist and client who do not connect at all. You'll notice a difference, you know, and that's just with people, right? We have friends that we connect with really well and we probably can get really deep with, and then we have relationships with people where it's like we have a hard time connecting, so the depth is only going to get so deep, right? So imagine in a therapeutic setting, you want to be with someone that you feel like you can trust, that you respect, and that gets you, you know, and if you don't have that, you're not going to open up to them, right? So just things to think about. I think we can learn a lot, and I think you should learn as much as you can in school, and understand theory and all those things. But when you have a real human in front of you, you have to take a lot of other things into consideration as well. And not everything is as simple or as black as white as a textbook, right? People are more complicated. So we just need to take every situation into consideration. Like, so let's say you have a specialization in one topic, let's say depression. That doesn't mean every person who's depressed is exactly the same. Everyone is different, right? And so you need to think of it in that way, kind of like a thumbprint. Every person is different. I know this is brief and is not at all in comparison to the amount of time that you would be in class, but I just know from my own experience that when I post lectures, I mean, I'm not saying that people don't listen to them, but I know they're only going to listen so long. But like I've said, I do want to come alongside you and join you in the remainder of this class and really answer any questions you may have, help you as best as I can. Because obviously law and ethics is a huge issue. Not that all your other courses aren't huge, but this is a big deal. And probably a lot of you are taking this class getting ready for being a trainee, which is really exciting. So this stuff is important. Not to say again that your other classes aren't, but this really, really is. So I hope this bit of information is helpful for you, and I hope the next few weeks run smoothly for you. And again, if you have any questions or concerns, please don't hesitate to ask. Don't worry again about a Blackboard this week. Everyone will get full participation points. I'm not here to make your life more difficult. I just want to, again, help the last few weeks to go really well for you. So I hope this is helpful and this made sense to you, and I hope you have a great week. Look forward to seeing you next week. Bye-bye.